center. And from that, we quickly realized that the demand after you test is treatment and treatment for STI. So the first step after the testing was to build the capacity in the organization to provide those services. One, because the ones provided by the government, as Erika pointed out, were not provided in the same, sensibilities. It's not a special service, but you do look for certain kind of, sensibilities dealing with LGBTIQ plus people. For example, the social name of transgender people, or the respect to the sexual identity or the gender identity of people, were not in the table at the time. So we started from that. In 2010, we opened up the clinic, and we started to provide, we cannot provide treatment as such, but we do provide the treatment for STIs and rapid testing after that. It started because of the homophobia of the government, and of course we didn't have any support from them. On the contrary, we have a lot of attacks on the model, legally, socially even. And from that point to this point, we are now the main provider in civil society of HIV-related services. 52% of the new cases found in the country are referred by our counselors and our strategies on reaching out to gay populations and bisexual populations. So we started, and now we are working with the government to improve their own responses and to provide resources to our community services. We are a community-led service, so it's another kind of thing altogether. We function in a community center. It's not a clinical setting. It's a more relaxed kind of social gathering place in which you can also have access to direct services here, and also other services through referrals that we do with the local government, and especially the local city, which was a very important thing. It was in our history was to make that Asunción is a signatory of the agreement for the 95 goals. So that was very important for us to achieve also.
Thanks, Simon. Erika, additional to the experience of Simon in Paraguay, you always travel around the world, and probably you know some other places where there are community-led services for LGBTQ people, but especially in developed countries, in rich countries, but probably there are some in developing countries as well. I don't know if you have known some of them. Can you tell us briefly about it? We know that you have some kind of time constraints and you need to leave very soon. So that's what I'm asking you about. What else do you know about in developing countries of these kinds of services?
Thank you, Jorge. And yes, unfortunately, I need to leave at 15 past the hour. But I think there are very good examples around the world of health services and HIV-related health services provided in a very unique way that is accessible and welcomed by the community. And I'm going to concentrate from services provided to the trans community. Unfortunately, I have only one example from developed countries. You can call another, which is in the mobile clinics, for example, in Latin America, that happens, where you have mobile clinics where trans women who engage in sex work are able to access services, preventative services, and also treatment, diagnosis services, etc. And that is very unique because it answers to the big need that the community has, that they cannot access services in a 9-to-5 setting in regular clinics. And also it's very difficult to go to services that are run by government, where many times you are met and criticized by who you are, or even in countries where it's not socially acceptable or there's legal constraints. But there are some amazing services in other parts of the world, and I'm gonna share very briefly around 4, which in my view are models that the rest of the world should really look upon and adapt in their different settings. The first one is the Tangerine Clinic in Thailand, which is a community service clinic that looks at transgender people from a holistic perspective, not only as vectors of a disease, of a virus, but looking at the individual from a human perspective with dignity and trying to answer to the holistic needs of the individual, including hormone replacement therapy, PrEP, education and housing and all other aspects. The other one I want to highlight is Clinic Q in the UK, which they do an amazing work and have been even in the midst of the very challenging environment that we know about in the UK at the moment for trans people. So you know, being necessarily from global north countries doesn't mean that everything is fine. We are really combating multiple issues relating specific to HIV, like stigma and discrimination and the labelings that come with it, but also other social aspects like the anti-gender movement, who is trying to erase our identities from this. But Clinic Q, you know, provides services and is a champion when it comes to PrEP access for transgender women, which for a long time were left out of the possibility of accessing PrEP. Also, USAPresenter in Paris is another organization that provides services for transgender women, and Trans United Europe in the Netherlands, which has a clinic where you can access HIV services, but at the same time, gender-affirming care. And it's really important, and we are starting to see new data around the relationships between access to gender-affirming care and treatment success and viral suppression, for example. These two organizations in Paris and the Netherlands, they concentrate in providing services to migrants primarily, who sometimes, because of legal aspects, cannot enter into the systems, and these countries have long waiting times to be able to access the system.
Thanks, Erika. Simon, in terms of HIV continuum of care for LGBTQ people, what will be like your best advice to city governments, or not to be afraid to invest or support these kind of community services for LGBTQ people? Because sometimes we feel that they must think that they probably think this is not a good idea, or this will increase stigma or something like that if it is open and directed only to LGBTQ communities. What will be your advice to them in case they ask you? Because we are dealing here with fast-track cities, so it's about cities.
Yeah, the strategy across fast-tracking things is to, you know, fast-track. So whenever you invest and you know, dedicate some resources to the community-led service organizations that are in their city, who will be better than them to, you know the territory, to reach the people, and to go where the government cannot go. No matter how much you try, you are still a government. You're still the city government. So there is bureaucracy, there is legal constraint, there is a lot of factors that equates into not reaching a lot of underserved populations that we all are. Queer populations across the world are underserved populations. We are not granted in any kind of right globally yet. So that only point is enough for, make the case for investment. Also, the thing about reaching locally to organizations that are within the city gives you the focalized, focus on the specific territories that you are intervening, and providing resources to whatever efforts are already on place is gonna be, in the long term, it's gonna be more sustainable, and it's gonna create a more sustainable environment and ecosystem, if you wanna call it, within your own city. So the case for investment is there. On the stigma side, that kind of argument for me is tiring, because it's the same thing. It sounds for me the same thing as whenever the far right cries about heterophobia or some kind of reverse racism or that kind of shenanigans that they invent. You cannot argue that providing a differentiated approach to a more damaged and to a more underserved population in order to increase their access, increase their knowledge, and repair some of the damage caused to them, to us, by the society at large, by the colonial states, by all these macro things that floats on our society. And you cannot call that differentiated approach to repair and care for those people with special needs. Because of those situations, you cannot call that discrimination. That's only, you are responding to reality. You have to respond to an historical fact that the heteronormative society in which we live, the patriarchal supremacist societies in which we live, really do bring a lot of damage to us and to our identities and to our existence. The cities had, as a state, as an administrative body, had a lot of privileges in that regard, for providing key support, political support, key economic support, especially provide the dignity and technical validity to our approaches, to our knowledge that we use in the day-to-day basis to serve a lot of people. I mean, there is a lot of layers. It's not only money. It's also giving us an opportunity to raise our voices in the political table and in the technical one, in which they decide across a lot of issues that the one that Erika mentioned, the time of the prestation of the service prestation. When do you open? 9 to 5, and how someone who is working from 9 to 5 or even 9 to 11, it's gonna go to that service. It's not if it is closed on Wednesday weekends and only address a very specific set of the population, the working population in those levels. So there is a lot of ways in which the cities can bring some of these ideas to the table and win a lot of political strength, and of course, we all as a community win a very livable city, a more livable and equal city. So it's a win-win scenario for all.
Thanks, Simon. Instead of me asking another question, I want to ask you, the audience, if you have any kind of very brief question or short comment before we end this at 5:15, because Erika needs to leave. In case, yes, I have a microphone here so I can hear you. We have a question from the audience. You say your name and your country, please.
Hello, my name is... Yes, my name is Camille Welling. I'm one of the medical doctors from the Trans United Clinic in Amsterdam. So thank you also for this beautiful presentation. I am struggling with all the news that is going on at the moment, a lot of attention going towards economic difficulties, a lot of attention is going towards the war and other challenges that are going on. And we notice that with our work that we do for the LGBT community, how can we make known to politicians, to policymakers, that we need to continue the efforts that we've put into and that we've reached to reach vulnerable communities in the past years, that that still deserves all the attention that we're giving to it at the moment. That's my question, whether the panelists have suggestions.
Okay, thanks. Anyone else who wants to make a question or a comment? I don't know, you heard clearly, Simone and Erika, if you want to address this question?
Yes. I'm happy to hear someone from Trans United is there, so that's really good. And thank you for the amazing work you do. By the way, I actually was able to access services through the clinic, so big up to the clinic. I think, you know, we always have to have so many competing priorities. And I always tell to people, in a kind of joke, but not joking, that when decision makers are making budgetary decisions and where programming should go, they make decisions like if the world was or the countries were the Titanic. So women and children first, then men, and guess who gets left behind? We. So we always have to suffer budgetary-wise, programmatic, policy-wise, because they see us as an expendable community. And, you know, I don't have the right answer of what can be done other than we need to work, unite forces to be able to advocate at different levels and be able to reach decision makers from different perspectives. And one of the things that I know politicians language they like to hear is, what is the cost effectiveness of such programs? So perhaps one idea that can be presented is showing them how much money they are actually saving by funding that program. So that is a language they will definitely understand.
Simone, you want to comment on that?
Yeah, I was about to point the last part that Erika said. It's always easier for us to frame whenever they fall into this kind of colonial thinking, in which you have a zero kind of situation in which you have to decide who lives and who dies, basically, in terms of budgetary or political priority to an issue. For me, I'm more on I'm kind of living in Paraguay, which is the most homophobic country in the region, in Latin America. And that's competing against Brazil with Bolsonaro, which is a lot. From here, this kind of artificial discussions are only, for me, are only masking for the actual thinking that we are not people, we are not human, you know, that's the thing. Since we are not human, we don't deserve any attention or priority to our needs or pain. So they enjoy our pain, they enjoy our suffering. They have this kind of Christian mentality in which they kind of, I don't know, see themselves punishing us for our sinful life. And that ideas always mask themselves in this kind of artificial discussions. So I really don't lose time with them. So I try to work around the people with power, more power. And in a democracy, the people with power is still the people, you know. If you want to force a politician to do something, you have to bring the people with you. And so when you know, find a wall, for me, it's better to, instead of stopping myself and argue with the wall, I find more people and just push the wall until it fell down. So my answer will be, you know, try to build an international solidarity caucus across our, you know, regions, countries, and capacity. For us in the region, within the region, that was the key for a lot of our successes, was not to take account on the boundaries, not to take account on the frontiers especially, and to work across frontiers and across sectors even, to share knowledge, share information, and strategies to mobilize people. Working with community organizing and working with community mobilizers is key for any of these situations. We are never gonna win a four-wall, closed-down discussion with someone in power. They are not gonna listen. They are just not gonna listen. They are gonna listen only if they see they're gonna lose something. And the only thing that we can make them lose is some of the respect of their community. So we need to shame them, to reveal them how they think, to reveal how cruel they are. In this day and age, it is unthinkable to put this kind of distinction at the table and not get any shit for it, because it's a shitty idea. So that will be, I'm a more, you know, on the indigenous side of things, so I struggle with this kind of being polite in this kind of scenarios. Sorry.
Thanks, Simon. I think Erika needs to leave. If you want to send a 30 seconds message before you leave.
Thank you, Jorge. Just to end by saying that also an idea would be is looking towards embedding community health service provision into national processes. So how do we ensure that, for example, the services provided by amazing clinics like TransUnited Europe are integral part of national health budgets? That to make it sustainable and not dependable on crisis crushing the great work that has been done and has been achieved so far. Thank you. I'm sorry, but I need to leave.
Okay, thank you, Erika. Simon, can you just stay here? We have just a couple of extra minutes here. I just want to comment by myself that we have here Dr. Andrea Gonzalez. She's the head of Clínica Condesa. It's a Mexico City-run clinic. But inside that clinic, they have a transgender clinic, which is, I think it was the first in Latin America and one of the biggest in the region, or probably the biggest one. I don't know how many transgender women you have. 3,800 users, transgender women, and they do offer several services for them. It's not exactly community-led, but it's community involvement heavily, because it has a lot of peer-to-peer education and some other services, not just HIV services, STI services, hormone therapy, and that's quite unusual for developing countries and for Latin America especially. Erika already mentioned one in Thailand as well. So just one question that I still have for Simon. Simon, monkeypox has been primarily affecting gay and bisexual men in Europe, North America, and also in Latin America, but also a huge proportion of those affected have been HIV positive men, and some reported cases among trans women too. Do you think monkeypox services such as testing and vaccination should be offered at these community services as well? Because it looks like in many developing countries, especially in Latin America, because I have been speaking with them, there is kind of reluctance of governments to consider monkeypox a sexually transmitted disease, even if more than 90% of the cases are associated with intimate sexual contact, but they are kind of reluctant of even labeling that way. What do you think, Simon? Because recently there was a gay Latino network meeting in Mexico City led by Simon, and they had a declaration on monkeypox, the Latin American Declaration on Monkeypox. So I would like to give a floor for just 1 or 2 minutes to Simon to tell us about that declaration and why you needed to have that declaration for Latin American governments, addressed to Latin American governments. Simon?
Yeah, well, with the first part of yes, I do think that every testing that we can do at the community level needs to be done. I mean, that's the first step. And if you are bureaucratizing testing, I mean, that's the point of entry of all the continuum and all the nice things that public health officials do. But, and so in that regard, yeah. The second part, why do I think that governments are not taking this seriously? Because it's a gay disease. It's just that. It's plain and simple homophobia. It's not another, there is not another reason. If this same, pandemic or epidemic outburst happens in, I don't know, children, or you will see a lot of different responses to it, including community testing. So I think it's just plain and simple homophobia. You can call it whatever you want. You can call it technical blah, blah, but it's homophobia. You can work your way around any of the excuses that you can think of if you have the will to do it. But if you don't have it, so we can talk about that. Regarding to the declaration of Gay Latino, for us as a network was again, it is an homophobia thing. We have an epidemic outburst in the region, and nobody is doing anything. So nobody is saying anything, and most of the countries won't even report on the cases. So in that scenario, we find it, key for us to have a common wording of how to address this and how to communicate this and how to, again, mobilize our communities in order to make the governments to listen and to sit to the table. The declaration was built on the meeting that the Gay Latino Network was held in Mexico City. It is the biggest meeting of gay activists on the continent. So it was, for us, the strength of having all the community leaders there agreeing and discussing and drafting a common strategy to work towards our government and agencies and all the global actors that we have in the region as well, was a very key point of our mission. The declaration was received with mixed results, I think, across countries. Some countries took it seriously and made a few steps in the right direction. Some others appear to took it seriously and then just mock it with a declaration that goes exactly against everything that we said in the declaration at the beginning. One of the cases is Mexico, which unfortunately we have a very vocal anti-vaccine leader in the health space. So it's very, it's very hard to break discourse there. Other good case that we have is Chile and Honduras, in which both governments took it very seriously, even talked with the gay Latino members on the country, and started to drafting some of the strategy that we need to have in place. And some others, well, they didn't even listen, but I think that the officials in the technical level did listen, and our points in the declaration are marking a lot of the responses across the region. Again, I think that we are fighting against misogyny and homophobia, plain and simple. So it's gonna be it's not a technical or logical discussion at this level. It's just emotional. So it's gonna be hard to win that kind of discussion in an environment heavily invested anti-science discourse around.
Thank you, Simon, and thank you all for being here, for participating. And I was told that we need to finish now. Well, thank you. Thank you.
Thank you, Jorge. Bye.